Did ancient doctors use magic spells to heal the sick? Many people think so. They imagine healers chanting over a patient, hoping for a miracle from the gods. The truth, however, is far more surprising and, frankly, a lot more impressive. Imagine a terrible headache that never goes away, or a serious head injury in battle. In many cultures, the proposed cure was trepanation, a fancy word for a simple, terrifying idea: drilling, cutting, or scraping a hole in the skull of a living person. It sounds brutal, but evidence shows it was a real medical procedure. Many skulls show clear signs of healing. Patients survived months or even years. Why do this? The reasons were mixed. To relieve pressure from bleeding or swelling, something neurosurgeons still do. In Peru, surgeons removed dangerous bone fragments. They also aimed to release evil spirits, often just blinding pain. Tools were simple: flint or obsidian, sometimes a trephine drill. Risks were enormous: infection, brain injury, bleeding. Yet in some regions, survival exceeded 75%. As we age, the lens can turn cloudy, what we call a cataract. 2,000 years ago, surgeons had a daring solution. The procedure was called couching. A sharp needle pushed the cloudy lens aside so light could enter again. Sushruta described piercing the white of the eye with a specialized needle. With precision, the lens is displaced until shapes return. The eye was bandaged with herbs and ghee to heal. It could feel miraculous, though vision stayed very blurry. The risks were tremendous and outcomes varied. For centuries, couching was a bold, imperfect solution that showcased ancient ingenuity and bravery. Long before drugstores, nature was humanity's pharmacy. Civilizations built pharmacopoeias: what to use, how to prepare, what doses to give. Egyptians used willow bark, rich in salicin, akin to aspirin. Poppies yielded opium, the ancestor of morphine and codeine. Ephedra contains ephedrine, still used as a decongestant. Without chemistry, potency varied by season, soil, and preparation. Right dose could strengthen the heart. Too much could be fatal. Rituals accompanied remedies and shaped outcomes. Belief created a powerful placebo alongside real chemistry. Ancient herb lore laid groundwork for pharmacology, walking a fine line between cure and poison. In Varanasi, about 2,600 years ago, a surgeon named Sushruta performed astonishing operations. He compiled a surgical textbook, over 120 instruments, 300 procedures. He taught by direct observation and hands-on training. Sushruta perfected forehead flap rhinoplasty, rotating a living skin flap to form a new nose, an idea used in modified form today. He advised heating instruments to sterilize them long before germ theory. He detailed incisions, managing bleeding, and classifying wounds and burns. Students practiced cuts on vegetables, sutures on cloth and animal hide, and studied anatomy from cadavers. His rigorous methods shaped surgery across Asia and the world. A toothache is universal and very ancient. 14 millennia ago, cavities were scraped with tiny flint tools. Egyptians and Etruscans advanced beyond pulling teeth. They crafted bridges with gold wire and bands. False teeth came from human donors, bone or ivory. Romans cleaned decay with bow-powered drills. A 6,500-year-old tooth was sealed with beeswax, pain relief by sealing the cavity. Yet myths endured: the tooth worm and henbane smoke that numbed pain. Practical dentistry coexisted with stubborn beliefs. For the elite, bridges restored a smile, even if not perfect for chewing. Ancient medicine mixed brilliant insights with deep misunderstandings. The myth says superstition reigned. The fact: they drilled skulls to save lives, pushed cloudy lenses to restore sight, and built new noses from living skin. Without germ theory, infection was every surgeon's great enemy. Practical care blended with spiritual ritual and aftercare. Willow bark led to aspirin. Sushruta's flap guides surgeons today. We refined their tools, but the mission to heal never changed. Remember the healers who came before, part of the same incredible story.